So robotic surgery is it's a robot that duplicates our hand motions while we're sitting at a console and translate those motions to instruments over by the patient. So robotic surgery has been a game changer for gynecologic surgery. Traditionally, the majority of hysterectomies done in the United States were done through abdominal incision. That meant the patient had a scar across her belly, either a vertical scar or a transverse scar, and she had to stay in the hospital 2 to 3 days. But with robotic surgery, the robot actually allows us, the surgeons, to have complete use of our hands in a laparoscopic setting and a minimally invasive setting. So with 3 little holes or 4 little holes, we're able to do the whole surgery laparoscopically. And that means for the patient, no big scar, she's able to go home in a day, possibly the same day, minimal blood loss, less complications, and most important, she has a great scar or no scar at all, and she's back to work and on her feet in 1 to 2 weeks. We've talked about using the robot for hysterectomy, but there are other conditions that the robot can be used to treat, and that includes precancerous lesions, cancer lesions, abnormal bleeding, fibroids, endometriosis, cysts of the ovary, and also pelvic floor dysfunction or disorders. So there is a plethora of applications for the robot, and hysterectomy is just one of them. So what are the questions that patients might frequently ask? So how long am I going to be in the hospital? And typically I'll tell patients that depending upon the procedure, we'll plan for an overnight stay, but in many instances, in the majority of instances, the patient's probably able to go home the same day. How many incisions am I going to have in my belly is a frequent question. And typically you'll have 4 to 5 little incisions the size of a keyhole on the abdomen, which heal with a Band-Aid. They might have some pain, and it's easily treated with over-the-counter medicines. When will they need to see me back? Typically I'd like to see the patients back in a week, just to make sure that they're doing okay. But then after that, probably they're on their own for about a good 5 to 6 weeks. But certainly if they need to be seen, they're seen in a timely fashion. But the majority actually don't even really need to be seen, because it's just to tell them they're really doing well.